Everybody's Faheem, pharmacy prescriber, contractor, founder of Medlearn. In this video, we are going to be specifically focusing on how do I approach a sore throat. Now, any of you who are struggling to find a DPP or develop your clinical skills or maybe set up community pharmacy, get in touch with us. My colleague Farouk will be leaving some details below so you can get in touch with us so we can assist you with any of these things. But in this video, our focus is going to be on one of the pharmacy first conditions, and that is a sore throat. So folks, switch off your phones, relax, follow me, and let's enjoy this video. So, sore throat. Now, Farouk, my colleague, had a great suggestion. Let's start with an example. So we have and I'll write it down. Let's say we have a 19-year-old. So we have a 19-year-old patient who presents with symptoms of pain in the throat. This is a common that you have a patient. Common scenario that you have a 90-year-old male patient, could be male, could be female, could be less than 19, and they present to you with a sore throat. Now, this could be a walk-in, this could be an NHS referral, this could be on the phone, but these are the kinds of scenarios that you're going to see with a sore throat, where they come in saying I have difficulty in a sore throat, or difficulty in my throat. They may also say, and they may have symptoms like I have issues with swallowing, so we've got swallowing problems. I find it difficult when let's say when I talk, so pain on talking. So some people say pain on talk, they struggle with this as well. The main issue is going to be the sore throat, but they could have swallowing problem. They could have pain when they talk. They could also have pain that goes to the ears, to the neck, so pain that radiates. So we could have pain that radiates as well. Patients may also say that they don't feel well, so they generally feel unwell. And they may also have, for example, fever. They might have fever. They might say that the heart rate's beating faster than usual. So these are all the other symptoms that you can have a patient present with. But you are dealing with the key, and that is pain in the throat. That is what we're focusing on. That is going to be the key symptom that you're focusing on, is you have a patient who says, look, I've got some pain in my throat. What do I do? Keep in mind, these are all associated symptoms that we are going to be diving into deeper. That can happen. But the key thing is here, and that is going to be the sore throat. Now, one thing that you have to understand, that you always have to have some sort of approach, a method in place how you approach these consultations. That could be a sore throat, that could be earache, that could be chest pain, that could be anything. And in previous videos, I've spoken about the importance of history taking. I've done a lot of videos on communication skills and the importance of communicating, because what you're doing here, all of this is a form of communication. And communication is more than just me speaking, making eye contact. No, a communication, I'm stuttering there. Communication is a set of skills that can be learned and developed. So communication is a set of skills. It could be speaking, it could be writing, it could be non-verbal cues like making eye contact, it could be rephrasing something and explaining to you how or what I've understood. So that is key. And this video is not on communication. This video is on a general talk about how to approach a sore throat. So we have this 19-year-old male patient who presents with a sore throat. May have any of the other symptoms, swallowing problems, drooling, for example, may have ulcers in the mouth, could be anything, might have a fever and so on. Okay, how do you approach it? The overall consensus is take a history, conduct a physical examination, then you have your differential diagnosis, and then you have your diagnosis, then you treat, I'm going to put T there, and then you can review. Okay, you can review. That's the general method that we're going to do, is we're going to gather the information. From this, we're going to have a list of conditions that could cause a sore throat. We're then going to examine to see which one it could be. We then make a list of what it could be, rule out which one it's likely to be. We then diagnose, we then treat, we then review. And the review is extremely important. So the first thing in this video that I want to discuss is the list of conditions that can present with a sore throat. You have to know this. If you don't know your conditions that present with a sore throat, you're never going to be able to treat a sore throat. You're always going to feel anxious. You're always going to feel that you're not fully prepared. And that's not because you're not knowledgeable, it's just because you haven't practiced this skill. So you have to know your list of conditions. Now, I like to, whenever I think of my diseases, I always like to break them down into different body parts. I think of the symptom, so it's pain in my throat, and I think what could be causing pain in my throat? It could be the obvious head and neck. Could it be potentially respiratory? Could it be abdominal related? Could it be cardio related? So I break down into the body systems because it's very easy to fall for the trap. If you've got throat pain, it must be an infection. It doesn't always have to be the case. Not at all. And we'll go through the list in a second. So we break it down. Could it be ENT related? Could it be respiratory related? Could it be cardio related? Could it be abdomen related? Could it be the urinary tract related? Could it be a rash, lumps or bumps and so on? You don't need to think of every. Sometimes you're going to have a condition that will not fit into cardio. It will not fit into abdomen, but at least you're thinking about it so you don't miss anything. So let's start to have a look at the conditions itself. And that's going to be the key thing in this video, is looking at the conditions, and we're going to break this video down into separate steps. So I've got my list of notes here so we don't miss anything. But the first thing is what you're all going to be familiar with, that's ENT. Now, I would suggest pause the video and think of how many conditions you can come up with that are related to a sore throat in a teenage kind of patient. Once you've done that, have a look at my list. So when we're thinking about the throat itself, the first one we can all agree on, that would be something like tonsillitis. So we'll put T there. That's going to be the common one. Tonsillitis could be inflammation of the tonsils. The other one could be pharyngitis. Pharyngitis, inflammation of the pharynx. So inflammation of the pharynx, that's the throat. And you know we can divide the throat into the nasopharynx, laryngopharynx, and so on and so on. Okay? So tonsillitis, pharyngitis. What else could we have? This person could have ulcers in the mouth. That could be causing the sore throat. But ulcers. What else could happen? This person could have a problem with the nerves. So glossopharyngeal neuralgia, I'm just going to say nerve pain. So one of the cranial nerves is a problem. He could have another type of infection, glandular fever. So we can put glandular fever. So we could have glandular fever, that this person could have glandular fever. It could be a fungal infection, so candida. So I put fungal infection. So you can see I'm just sticking to head and neck at the moment. Head and neck. I've spoken about the tonsils, I've spoken about the throat itself, I've spoken about the different viruses, bacteria and so on. Trauma. It could simply be trauma. Maybe they had something very hot to eat, so it could just be trauma. We can put trauma. It could also be a problem with the thyroid gland. Inflammation of the thyroid gland. So you put thyroid down. Now, all of a sudden, you must be thinking, well I hope you are, that if I had this knowledge base, all of a sudden my sore throat diagnosis becomes a lot easier. Because I know all the conditions that could be causing it, or potentially some more conditions than I already know that could be causing it. It makes you feel more comfortable. That's the key thing. This is not difficult. Once you have your list of conditions, and then you also know the various signs and symptoms and how you can rule them out, things become a lot more easier. So we have this here. Also, let's think about the abdomen. What could be affecting the abdomen? So we could have GORD. Could be simply reflux. Could be reflux related. Again, going here, it could be some sort of herpes infection. So reflux, some sort of herpes infection. We could have GORD down here. We could have cardio. We could have some patients who might have inflammation of the aorta. So you can have some people who have inflammation. Again, this is very, very rare and unlikely, but it could be that as well. Then we've got some other rare conditions, again, related to ENT. We've got diphtheria, we've got epiglottitis, we've got various types of abscesses that can happen in the head and the neck. So you can see that we have various different causes that can happen. I'm just going to double check my list to see if we've not missed anything important. So we mentioned tonsillitis, glandular fever, abscess I mentioned to you, Quincy, you might have heard of that. We mentioned fungal infection, we mentioned sore throat, we mentioned GORD, trauma. We've pretty much mentioned all the common things that can happen. So once you know this list of conditions that could be causing your sore throat, all of a sudden this 90-year-old patient is not that difficult to treat because you know the diseases that can cause it. But this is mandatory. Then what happens is, we're going to start to look into gathering the history and the exam. But before we go further, I just want to briefly start to look at tonsillitis for you. And let's think about the conditions itself, tonsillitis. Now, what we want to do is, first of all, think about what is the common cause of a sore throat in kind of a teenage age, above the age of 6, going to slightly, university style. And let's look at another pen that I have. Let's see if this one's working well. Now this one's expired, a bit like my finger. Let's have a look here now. Okay, let's look at this sore throat now. First thing I would say when I'm thinking about a sore throat is the etiology. What's one of the major causes of a sore throat? So you can write down etiology. Major cause of a sore throat. The first, one of the most common cause of a sore throat that you're all familiar with is the beta hemolytic streptococcus pyogenes. This baby here. And for those of you who don't know what this means, it's fairly straightforward. Beta, there's alpha, there's beta, and I can't remember how you put gamma, but I'm going to put G for gamma. Alpha, so this refers to, this here basically refers to the breakdown of your red blood cells. So what happens is this particular bacteria, when you put it around red blood cells, it destroys the red blood cell. Depending on the type of destruction, if it's partial, if it's complete, if it's none, we can grade this. This is beta hemolytic. Hemo, blood, lytic, cut, lysis, break. So this one causes beta. This means that it total destruction of the red blood cell. So if you was to put this bacteria, if you had a bacteria and you put this on a petri dish, so we have a petri dish here and we have some, let's say some red blood cells here, this bacteria will destroy all these red blood cells. So we call it beta hemolytic. Okay? Streptococcus means that it's a type of bacteria, and this is a gram-positive bacteria. And you folks should know this, if you've studied pharmacy, medicine, nursing, is gram-positive. The other one is group A. Group A. We can group bacteria depending on the various different molecules they have attached. If they have a certain carbohydrate, we classify them according to Rebecca Lansfield in a group A. So, what you need to remember, the common cause for the bacterial infection is group A, beta hemolytic streptococcus pyogenes. What does group A mean? It means, Faheem, it's this particular bacteria has a certain carbohydrate component. Tick. Beta hemolytic, beta means full. It totally destroys a red blood cell in a petri dish. Streptococcus, it's a gram-positive bacteria with a certain shape. I think they're normally spherical. Pyogenes means fever. They produce fever. This is one of the causes that can cause it. The bacterial cause. What about your viral causes? So your viral causes will be, for example, we have, and I'm going to write out this. I may have got this right. So we've got, first of all, we've got influenza. We have, I believe this is para-influenza. We have, again, my handwriting can be terrible, adenovirus. And this one, I believe, is the rhinovirus. So we've got rhinovirus, we've got influenza, we've got para-influenza, we have adenovirus, and we have the coronavirus. So that's your viral causes. There's bacterial cause, which you know, group A, beta hemolytic streptococcus pyogenes, and we have your viral causes, we have, which I've listed here. Then we've got other causes, for example, herpes. We've got herpes as well. We have the Epstein-Barr virus. We have the Coxsackie virus and various other viruses as well that can be causing a problem here. Your bacteria, mainly this one, we have Neisseria gonorrhea, we have Fusobacterium necrophorium. So there's other types of bacteria that can cause it as well. That's the key thing to remember. So what have we discussed so far? When I have a patient with sore throat, in this video, we're going to break it down to chunks. This is the first video. I want you to go back and research these conditions. How well do I know these conditions? How well do I know my tonsillitis, pharyngitis, herpes, fungal infections, ulcers, thyroiditis, inflammation of the thyroid problem? How well do I know my gourd? What about sort of problems that can affect the aorta? First of all, have a look at these conditions. Then what we've broken down in this video is I've broken down the different causes. We've got bacterial, we've got viral, and we also have technically candida, fungal as well, infections that could be causing. So whenever I'm approaching a patient with sore throat, the first thing I do is I try to find out which one of the diseases actually could be causing the symptoms. In the next video, we're going to start to break down each condition and discuss it. For example, in tonsillitis, you get A, B, C, D, E. In pharyngitis, you don't get this. If you have an ulcer, you don't get this. So you can break it down. Then we'll look at the history, then we'll look at the physical exam, then we'll look at the treatment. I hope you found this video useful. Thank you for watching. Any of you folks, once more again, struggling to find a DPP, want to open your pharmacy, or want to develop your clinical skills, get in touch with us at Medlearn. Thank you for watching. Everybody's Faheem, pharmacy prescriber, contractor, founder of Medlearn. In this video, we are going to be specifically focusing on how do I approach a sore throat. Now, any of you who are struggling to find a DPP or develop your clinical skills or maybe set up community pharmacy, get in touch with us. My colleague Farouk will be leaving some details below